Next, we're going to talk about the mnemonic for difficult BVM. The mnemonic is Roman. This stands for radiation, restriction, obesity, obstruction or obstructive sleep apnea, mask seal, Mallampati, male gender, age, and no teeth. First is radiation. This is actually one of the strongest predictors of difficult ventilation. This can be a patient who's had radiation therapy due to cancer treatment. Restriction is also a problem. We think about this, we think about restricted neck motion, but we also think about lung restriction, such as COPD, ARDS, or reactive airway diseases, such as asthma. There's 3 O's to remember in Roman. Obesity, so someone with a large body habitus, or this can be a patient who's overweight, or even a patient in the 3rd trimester of pregnancy. It's important to note that these patients are difficult to oxygenate at baseline, and they also desaturate much quicker than someone with a normal body habitus. This is because the resistance from the weight of the chest and abdomen makes it difficult to get chest rise and full lung expansion. It's also because of redundant tissues that cause airflow resistance throughout the oral pharynx. The next O of obstruction are things like angioedema, Ludwig's angina, croup or laryngospasm, and of course any kind of mass such as a cancer or hematoma, of course a foreign body. Lastly, if someone has a history of obstructive sleep apnea, they're also going to be likely difficult to beg. There's 3 M's as well, so mask seal, Mallampati, or male sex. Any disruption of the facial continuity is going to make it difficult to get a seal. So big bushy beards can prevent a mask seal. You may overcome this by lubricating around the facial hair to improve your seal. Male gender, for some reason, is a high predictor of difficulty begging versus female gender. This may be because males have less adipose tissue in general. And then lastly, Mallampati score. So someone with a high Mallampati of 3 or 4 is also likely to be difficult to beg. The age of the patient is also a factor. It's very rare that small children are difficult to beg. Elderly people, even 55 or older, is associated with higher risk. This is because we have loss of musculature and loss of elasticity of our tissues, making it more difficult to get a mask seal. Lastly is teeth or no teeth. So leave the dentures in place during BVM. Even though we like to remove them during intubation, they can be very crucial for getting a good mask seal. If someone has no teeth and they don't have dentures, you can actually insert some gauze along the cheek to improve the mask seal. Lastly, you can roll the lower lip down towards the chin and put the BVM mask inside the inner lining of the mucosa to get a good mask seal. That's Roman. Those are the predictors for difficult BVM.